Welcome everyone to the webinar today by Jason Hines, co-founder and CEO of Gigasheet, and Todd Cullen, CPO at Epistemix. We are excited to show you the products and walk you through some of the analysis we have done. So I'll give it to Jason to get started.
Yeah, thanks, Amu, very much. It's great to be here with you today and great to be with Todd and the Epistemics team. It's been awesome working together with them. A little background on myself. I started my career as a software engineer. I've worked in a variety of different industries, defense, national security, worked for Google for a while, most recently in cybersecurity before starting Gigasheet about 5 years ago. And really most of the work that we've done at Gigasheet involves health data, particularly price transparency and public data related to commercial markets. Todd, I'll let you introduce yourself real quick and say hello.
Yeah, sure thing. Todd Cullen, I'm the Chief Product Officer at Epistemics. I am a computational biologist by training, software engineer by trade for most of my career before I turned to the dark side. Started working on some AI products that I'm going to have a chance to tell you a little bit about here on the call today, but really excited to to dig in and chat about this with you today, Jason.
Yeah, that sounds awesome. So why don't we just set the stage with the agenda a little bit here, and we'll give you a little background on. I'll give you a little background on Gigasheet, the work we do. Todd will talk a bit about Epistemics as well, and then we'll get into sort of the meat of the conversation, which has to do with combining really the price transparency data and analytics that we do here at Gigasheet with the agent-based modeling capabilities of Epistemics. And if you don't know what either of those things are, don't worry, you're about to get a very quick and dirty explanation of both. And then we did some work together for today on a case study around diabetes in Miami, where we'll look at some real data and a real model that was run and sort of the outcomes and how these can be applied for different stakeholders in the health ecosystem. And so that's pretty cool. So that's what we're going to dive into. First, I'll give you a little background on Gigasheet. So really at Gigasheet, we built this big data analytics platform, and it turns out that it's really good at processing what are known as machine readable files. So what are machine readable files? Full disclosure, I didn't know what machine readable, I mean, I know what a machine readable file is, but it's sort of this term that has been coined around transparency and coverage, and the hospital price transparency rules, which if you're unfamiliar, these are new rules that went into effect in 2021 and 2022. 2021 for hospitals, 2022 for payers, where they must disclose the negotiated contracted rates with providers. So the whole idea was to provide more transparency into how things are priced, procedures are priced in healthcare, and what those rates are in order to drive more competition. We do a lot of work with this data. Not everyone, these files are massive and therefore machines. And you need to generally, if you want to work with them, you'll need to write code. And if you don't know how to write code, you're kind of screwed. So that's what we were like, that we should solve this problem. More specifically with the data that hospitals and payers publish, they're massive. They can have lots of irrelevant rates. Fields are inconsistent and difficult to interpret, and that's where Gigasheet comes in. We apply lots of data cleaning and analytics to process all of this data and make it available and consumable for all different kinds of use cases. So, bottom line, the price transparency data is very messy, but that doesn't mean it's not useful. We are applying lots of methods and have had a number of great successes. And you'll see how Epistemics is able to consume this data and put it to a very novel use in just a few minutes. So let's talk about the overall data here, price transparency data. Just because it has transparency in the name doesn't mean it's clear at all. For example, Idaho, which is not the largest market in the country, when we process that data, it starts as 1.2 terabytes of data and turns into 34 billion rows of rates, where each row is a rate between a payer, a provider, and a particular billing code. After we run it through our pipelines, our cleaning, our deduplication, it reduces about 99% of that data to just 206 million rows of usable output. So it gives you an idea. So when we do this nationwide, you have an idea of just how large that can be. At the end of that pipeline, it's multiple terabytes of data. So just a really large set of data, a lot of noise in that, but that doesn't mean there isn't some gold in there. And that's really what we focus on. And throughout my career, what I focused on is finding signal within the noise. And that's what we do at Gigasheet. So the first step in this process is to collect the MRFs. These are published by providers, hospitals, and payers. The data we're going to look at today is payer data. The payer data is richer, more voluminous, and is updated on a monthly basis, whereas the hospital data is updated far less frequently. There are many more hospitals, and frankly, the CMS compliance with the rule is not as good across hospitals. It's getting better. All of it's getting better. We do a lot of data cleaning and deduplication. And then once you've got the raw data, that's fine. It is public. It's somewhat, it's reasonably accessible if you have a large system that is capable of processing it. But then we do a lot of enrichment. We add details around providers, location details. We also add Medicare benchmarks, as well as in the next step, do entity resolution. So as you probably know, if you're at all aware of the healthcare system, there are many entities, many providers. Providers may work at different hospitals or organizations, and so all of that has to be kind of accounted for. And then we do scoring and analytics on top of it to determine benchmarks and filter down to really kind of closer to ground truth and apply it to solve problems for our customers. So I'll show you just real quick what the data looks like so that you can see the data that went into the demo that we're about to see when we talk about Epistemix here. And what we're looking at here is actually Gigasheet. And this is what the data looks like after it's gone through all that processing that I described. This is data for all of Florida. And you can see here we've got 8.8 billion rows of rates. Each line is a rate for a particular provider. We have their location, their tax ID in here, the plans that are covered by this rate, even the file where the payer published it, as well as just details like the billing code and the payer that processed it. So, or the payer that published this information. Gigasheet has lots of tools for analyzing and processing the data, like doing pivots, for example, which will take a couple seconds. I mean, it's 8.8 billion rows of data, but you can start to filter this and group it in different ways so that you can make sense of it and really start to understand the data before you build it into your CRM, your contracting system, your RCM, or your agent-based model. For example, you can see the payers here. Florida Blue has 5.6 billion rates in this particular file. That makes sense. They're one of the major players in this market, and we can see the others here as well. Specifically, let's look at a breakdown of diabetes data. We're going to talk about diabetes a little later. So what we did is we selected a number of billing codes that are specific to diabetes, which you can see here, and Todd will talk about this a little more. We could start to analyze this data just to get a quick sense for what's available within this data set. Here I'm going to filter it just to providers. So one of the things we might want to do is say, okay, these are all the rates for all possible providers that could provide diabetes care. But maybe I want to just filter it down by, say, taxonomy code, which is their specialty, to just family medicine, primary care providers, nephrologists, people who do this, routinely, and kind of clean it up. And then I want to organize it by provider name. So I've grouped it here. And you can see University of Miami is a huge provider in this data set. And maybe I want to calculate some quick aggregations on this. Like, let's take a look at the median rates. So just quick data exploration, we can see, there's quite a range of median rates here. We could then break it down by payer in all sorts of different ways and analyze it for use. So this data is used by payers, providers, self-funded employers, benefits consultants and partners, and statistical and agent-based models, which employ AI. And that's really what we do at Gigasheet and what the data behind the scenes looks like. So now I'm going to hand it back to Todd. We're going to talk about some of the AI applications that Epistemix
dig into that. So I'll tell you a little bit more about Epistemix. So first off, at Epistemix, we help our clients drive better health and economic outcomes by simulating every person, place, network, and connection in the country. This allows us to help our clients to make better data-driven decisions with confidence. And we do this through a process that Jason's already mentioned, is agent-based modeling, but it's built from the ground up first through a digital twin of the United States. So this is that basically a collection of all the people, the demographics related to them, the economic attributes that are related to them, whether or not they have insurance. We have connections to where they live, where they work, where they go to school, the daily activities of life, trade areas. So, where do they go to the supermarket, et cetera. And we basically combine this whole this data set that allows us to build a kind of the core population of the United States, and we combine it with client data. So this can be either data, like perhaps you have a claims data set. We can integrate that directly into our digital twin, or it can be data providers like obviously Gigasheet, right? That we can use to pull in and enrich the synthetic data set to create this like proprietary data product for our clients that represent the world. And with that core population, we can then proceed to build a series of different models to simulate both baseline cases. So like, hey, let's build a model that represents the world as it is right now. And then we can also simulate different interventions that we want to subtly modify that world going forward in the future to achieve certain types of outcomes, right? And so you can proceed to then do a whole range of scenario testing tasks to basically ask the most like kind of strategic questions that your organization has in order to drive very specific outcomes by trying a whole range of different scenarios and see how they're going to play out over the next 12, 24, 36 months or longer, which ultimately allows you to basically see what combination of levers does your organization have control of that you can pull to drive the greatest impact and outcome that your organization is looking for. And so, the CEO and founder of Epistemix would kind of describe it this way as a quote from him, that we give leaders the tools to better understand complexity and behaviors so they can positively influence the future. So yeah, with that, I think we'll probably jump right into the diabetes market pricing analysis. So first, just want to let people know we're going to be looking at the Miami, Florida area. We're going to be looking at those two treatments that Jason mentioned earlier. We're going to be looking at continuous glucose monitoring and diabetes self-management training. And obviously, this analysis is only possible through Gigasheet's pricing data set and then the suite of Epistemix simulation products. So let's just, I guess, get some fundamentals about the healthcare market and pricing. So first off, why is there a lack of kind of clarity on pricing in general? So kind of some of the top line items are one, that pricing is just fundamentally opaque, right? Because you've got, negotiated rates that are difficult to access, really hard to benchmark. Obviously, you have geographic differences and provider locations, and also differences in patient density located all around the country, and obviously difficult to access those rates unless you're working with a group like Gigasheet that make that pricing access considerably easier. Two, you have limited supply, so providers can be in different levels of density located throughout the country. Inelastic demand, so obviously in the healthcare space, patients don't really necessarily drive price in a lot of cases, right? So insurance is kind of hiding the true cost of a lot of the expenses that are being borne by patients, and so that can create some inelastic demand. And then lastly, we have long-term contracts, right? So a lot of the treatments that we're talking about are going to be 3 to 5 year contracts that are being negotiated, which means that the negotiated price can get significantly out of sync with the underlying market dynamics. And we'll talk through a little bit of that when we look at the examples here. So the results of this is that you kind of get a murky market, right? That you have to try and make your way through, right? So one, you can obviously run into mispriced services, and this is pretty common. You can have overpriced competition, right? Where rates are significantly higher for certain providers than others. You can get undervalued services and products as well. This happens quite often when you have providers that are basically setting their price to whatever the low reimbursement rate is for CMS or Medicare. And then I think probably the most important thing is just understanding that the group that has the most data on the market dynamics and pricing are going to be the ones that when they come to the negotiation table are going to be kind of best prepared to kind of renegotiate with a significant advantage and get the best rates for their organization. So just to, I guess, be clear on where these two treatments that we're going to be looking at kind of show up. The diabetes self-management training is an education piece that is normally provided to diabetes patients right after diagnosis. So you see it right there as the second step in the process. And then continuous glucose monitoring is obviously checking the blood sugar levels. That happens on a continuous basis, as the name suggests. And it's checked by a doctor once a month. It is the most common treatment and CPT code that shows up for anyone with type 2 diabetes, so very common in the data set that we're looking at. The education piece is actually less prescribed. It's available on almost every healthcare plan, but it is not the most common prescribed treatment for people with type 2 diabetes, and we can look at some of the pricing discrepancies that come up from that as well. So we're going to be looking at kind of three lenses when we do this analysis. We're going to be looking at demand. So like where are these diabetes patients located? How and where do they access care? Two, we're going to be looking at supply. So what services do each provider offer? Where are they located, and how much capacity do they have to provide that specific treatment or service? And then lastly, we're going to be looking at a pricing lens, right? And this is obviously driven by Gigasheet's data set. How do negotiated rates for a specific payer and provider combination compare to Medicaid rates? How do rates compare to others that are providing that same service in the local area? And where are there variations in prices? And how do, for example, these impact a potential renegotiation, right? So be thinking about kind of in that context. I'm going to go through the methodology very quickly. You don't need to be a data scientist to follow through on this. It's going to be real high level. So first off, we are doing a simulation of the world. So as such, when we look at kind of the catchment area or the service area for a particular provider, when we do a provider by provider analysis, we're looking at, okay, roughly if patients are only going to travel 20 minutes to be able to get to that particular provider, what is the real shape of that when you actually factor in like actual, for example, drive time conditions, right? So we're not doing the analysis that's to the left here, which is just like a pure radius. It's just a pure circle. We're doing what's known as an isochrome. It's travel time, and it's on the right. It's a bit more of a dynamic shape, actually simulating the way people actually interact with communities and providers in the real world. We then use that catchment area for each provider to be able to generate both the number of patients with diabetes. This is getting pulled from the digital twin that Epistemix has, So we can tell you exactly how many people have diabetes within that specific catchment area for a provider. And then obviously we can pull from the Gigasheet data, how many providers are there located also in that catchment area. And that's kind of the competition, right, for that specific treatment. And we can confirm that all of those providers provide that treatment that we're analyzing. And so when you combine both the competition and the demand with the analysis that we're going to show here of like the provider median price versus like the local median price for that specific treatment, we can start to generate a single number that can really help us to evaluate how competitive a specific negotiated rate is between a payer and a provider for one treatment.
So
And
this
this,
would this would be like your way that you guys calculate or benchmark the market, right?
That's right. Yeah. And it basically allows you also to imagine that you can run this type of index, right, against a wide range of providers, wide range of treatments, looking at a whole host of negotiated rates, right? And you can set some thresholds on this index to be like, okay, we're gonna mainly go through and look at like these specific ones that hit over a certain index rate, because clearly there's something occurring in that space. It gives you a good thing to focus on for negotiations. So we're going to take a peek at two potential negotiations, and we're going to focus specifically on a treatment and a provider and a payer. So in this case, we're going to be looking at United Healthcare of Florida as the payer. The treatment is that continuous glucose monitoring that I mentioned earlier. And in this case, we're looking at the provider, which is Coral Coast Integrated Care Partners. It is, the names have been protected, or names have been changed to protect the innocent. But this is coming from obviously real data from Gigasheet. And the question that we're asking here is obviously, how would United Health Group negotiate with Coral Coast Integrated Care if they were to have like a negotiation happening today? So let's kind of get into it. So United Healthcare of Florida, what do they know going into that negotiation at the start? So one, they would know that they have four locations, so four specific sites in this Miami area. They have 9 providers that are spread across those four locations. They know the current negotiated rates, right, coming into the discussion, and they would obviously have a significant amount of claims volume that are connected to this specific provider. And just to get a rough sense of kind of what the locations look like, we have some photos of this particular provider there on the right. So if we first start off by looking at this through the supply and the demand lens, we know that for these four locations, for these four locations and the continuous glucose monitoring treatment, there's 1,580 competing locations within that catchment zone, right? So really high supply of providers that are providing that specific treatment. However, there's only moderate demand for patients that actually need that treatment. So high supply, kind of moderate demand means that in general, the provider in this scenario, just looking at the supply and the demand, probably does not have a significant amount of leverage going into a negotiation to try and raise rates for themselves, right? So this already starts to look like a good scenario for United Health Group of Florida. Then when we start to take a look at the pricing lens, we start to look at the pricing rates for this region. This kind of opens things up a little bit more. You can see that United Health Group is paying, right, this particular provider $73.63, the median rate, it's the average, for those services. All other payers for that same service at that same location are paying $54, right? So significantly less. And then when you start looking at that treatment at other locations, United Health Group is paying about $30, all their payers are paying about $33. So high supply, right? A lot of providers provide this service, right? This particular location charges a lot for it, really gives United Health Group a lot of leverage going into the next negotiation to try and significantly cut rates, because otherwise they could push their patient groups, obviously, to other providers by taking this group, for example, out of network. Um, so we'll pause there. Any?
Yeah, I think that makes sense, and we know from our experience with payers and providers that when they bring data like this to the negotiation and just kind of lay it on the table, it makes things go much more easily because it's not just somebody's opinion, right? It's not like, well, we think you're getting paid too much, or we think we deserve a better rate. It's like, well, this is the market, and here it is. So just having data to back up your argument is has proven to be and will continue to be essential. It's kind of like you said earlier, Todd, about how whoever has kind of the best data often wins, and we continue to see that.
Yeah, for sure. So we have one other example that we can kind of share here, and this is another payer example. It's Aetna Health, same space. So looking at that diabetes self-management training. So the provider in this case is Biscayne Bay Medical, and we're going to just basically run through basically the same scenario here. And obviously there's slightly different dynamics in the market for this one. So they only have 3 locations, 7 providers. Their current negotiated rate is around $39. And this is all stuff that Aetna obviously would know going into this negotiation. So if we jump in, let's look at the supply and demand lens here and get a sense of what the market for this specific treatment looks like. So one, there's still, for this group, a relatively high supply of locations that provide this specific service. So 257 competing locations. This is more competitive than 99% of Miami provider groups. So the specific locations that this is at puts them in contact with a massive number of other providers that provide the service compared to the demand for the service, which is very light. It's only 383 patients per provider. So this is a really difficult situation for providers to be able to try and push up rates because the supply and demand of the market really make it difficult for them to do so. When you start to then look at the pricing for this particular treatment, you get a couple of interesting things here. One, you can see first off that Aetna's pricing versus other payers at the same location, Aetna actually has preferential pricing already. It's actually doing better than any other payer for those specific locations at Biscayne Medical. So it's doing well from a negotiation for that specific provider. But if you're looking at other providers in that area that provide that treatment, they're still paying 3 to 4x the price of the rest of the market that Aetna has set in that area, right? Aetna's average for this service is only a little less than $11, right? All other payers and providers are paying something around $18. So, all in all, looking at this comes out as kind of another good opportunity for a payer to be able to potentially leverage this data to be able to push prices down. And similarly, obviously, you could imagine providers using similar types of data, right? Obviously, to make arguments for negotiating rates up as well. So I guess with that, I guess I'll just kind of quickly kind of wrap up here that the main benefit, obviously, the bringing data to the negotiation here is one, you can use it to identify like alternate providers and evaluate switching opportunities. So from a payer perspective, right? They can look at it through that lens. They can understand the demand landscape both now and the big thing with ABM is we have the ability to look at it in the future. So the analysis that I've been showing is really centered around the baseline today in 2025, but we could very easily project this out, years out to give you a sense of what you need to not just be thinking about right now, but over the course of the length of those long negotiated contracts, right? If it's going out 5 years, you really are going to want to have a sense of what the supply and demand is going to look like at that point in the future, and we can help you do that. And then lastly, spotting like contracted rates that are significantly out of sync with the rest of the market. So we have the ability to basically drop in, use the Gigasheet live data feeds, and be able to give you kind of alerts anywhere in the country when rates start to kind of diverge from what clearly appears to be the like new local norms. And we can help you put together all types of packages where you can set certain standards, and we can make sure that we like kind of notify you when things go above some type of alerting threshold, to help you start to think about when you want to bring up renegotiating to start to get pricing back in sync with the market. And so all of this should basically contribute to significantly better leverage within your negotiations and payer provider discussions. So yeah, I guess with that, Jason, if you have
Yeah.
any additional thoughts.
I think that's great. I mean, there's so many applications for this, and we obviously just showed this one example. Full disclosure, we're not experts on diabetes care by any means, but obviously our customers and clients bring a lot of market knowledge to the table, and then this is a use case for demonstrating what's possible, and this is just one of those. Like, there's so many other applications, like you can imagine with those drive times for a self-funded employer where your population of covered lives, you know, our young families, childbirth, things like that. So you might want to apply it and see, like, realistically how many people, how many, women's care providers there are in that region, pediatrics groups and things within a realistic drive time, not just the simple, radius. Or one of the things we've worked on together with Epistemics that I think is particularly cool is more on the provider side, like a health system, and looking at projecting forward, like, okay, where should we open an imaging center, right? Like, based on how the population is changing. Like, maybe Todd, you could talk a little bit about that, like, example,
Yeah.
how you could sort of plan your business and profitable business lines and things. I thought that was a cool example we've worked on together.
Yeah, totally. So we've worked with a few organizations in helping them to think about planning, so capacity planning, both for the near term and long term, right? So if you're thinking about how you one might need to augment your kind of like near term capacity, whether that's bringing in more providers, looking at kind of like hiring plans that you need to be thinking about over the next 12, 24 months, or more longer term planning where you're actually thinking about, all right, where do I need to actually either like purchase real estate, think about building up additional facilities, and specifically once you have a facility, what are you putting in it? And so helping people come up with a data-driven system to actually model out, okay, what's the changes in the population? How is that going to drive the need for specific sets of services? And then the one that I think is kind of fun is also thinking about what changes in technology, treatment, drugs are going to be potentially coming online in the coming years that are going to substantially shift demand and need for different treatments that you may already be offering or thinking about right now. So, Jason, I know we talked about it prior to this, that like, one area that I think is kind of interesting to think about and has been written about a fair bit is, the impact of GLP-1s
Hmm.
on long-term treatment for things like diabetes, right?
Right.
When GLP-1s get to the point where they're like kind of prevalent, and anyone trying to manage their weight, right, or using them for that purpose, it really reduces significantly the amount of people who long term would be diagnosed with something like type 2 diabetes, or even folks who are pre-diabetic. And
Right.
what are the implications in the market for that, right? Both what treatment services are going to be needed, also what other drugs might see less overall demand. So yeah, it our kind of world simulations allow us to play out scenarios like that, very easily, and enable you to really play around with the levers that your company controls to understand how you can move the market in the direction that's going to kind of best suit your strategic needs.
Yeah, for example, like, we could assume, GLP-1s are going to become more and more prevalent, but maybe they come out, they get the tablet form for oral approved, right? And then you can get it in the mail or at your local pharmacy. You don't need the injections anymore. How will that change all these downstream services that are needed? It's really, really cool what you can do with the agent-based models. And then overlay the pricing data to kind of see what the possible economic outcomes are. Um, yeah, so thanks for joining, everybody. There is a Q&A panel that you can put questions in. It looks like there are a couple of questions, I think, already. Amu, do you?
I don't see any questions, but I have gathered some questions during our registration that I can ask. One of them is, do you incorporate claims data into these analysis?
I'll go first, and then Todd, I think. So all the data we have is publicly available data, unlike de-identified claims data, which you can usually buy at a quite a high price. The data is publicly available, and there are no restrictions. But we often will like join it with claims data or utilization data from other sources. For example, we definitely use Medicare claims data. But Todd, I know you guys do a lot of work with this too.
Yeah, yeah, for sure. I mean, so we will enrich our digital twin with claims data from our clients quite often, and the benefit of that being that we can like basically use that to derive historical patterns of healthcare utilization for each of the individuals in the digital, the digital twin that we have, and then we can use that obviously in our simulations to help create kind of a model of the mind, the way that people think about either product adoption, healthcare utilization, access, technology preferences. So, for example, obviously there's a lot more digital apps these days, but only certain groups are more prone to use those digital apps than other means of accessing certain types of treatment. So, having things like that built into our model, claims data can be extremely helpful, obviously, for us to be able to build in those types of behavioral patterns that we can use to then do forward projections about how the population will change over time and how behavior emerges that would be difficult to
Such a good point.
guess
Like,
otherwise.
I love the telehealth thing where you could just, my kid's got a cold and we just want a quick check. I love that. But there's no way my parents are using that, for, they're in their 80s and that's just not practical. But obviously over time, that's going to shift and change. So it's really cool how you can use like AI to sort of play that forward and love that.
Yeah, I mean, I think we think about even especially, I mean, Florida feels particularly relevant in this case, right? Because it's
Mhm.
if such a large retiree population, even if you're thinking about as like, for example, a payer where you want to be focusing your negotiation, being able to look at technology consumption habits or technology use habits to decide whether or not you want to be doubling down on, okay, do I need to be working with like, the digital apps and trying to really get their pricing dialed in? Or is that such a relatively small portion of the overall use that I want to be focusing more on the straight like telehealth options because my population that I'm taking care of skew more in that direction and understanding those habits today and then how they're going to evolve obviously over time.
Mhm.
Extremely helpful in being able to prioritize where you're putting effort.
Cool. Thank you so much for answering that question. Another question that I've gotten is, how do you handle imperfect or duplicate or even outlier price transparency data? I guess this is more for like Jason.
Yeah, this data, it's common to see outliers and duplicates in this data. We do a lot of deduplication, but we actually calculate metrics and scores on top of the data to account for that. And that's where like really data science and analytics come in, where, it's very difficult to get an extremely clear, precise read on these contracted rates. I mean, there's all kinds of complexity. The data itself is, and claims data as well, is just inherently complex. So, we use math to account for that and to, drill, really land on what we believe is, ground truth and a good relative benchmark. Um, and then obviously epistemics does the similar things like looking at median rates or interquartile ranges in their work. I know they do that as well. So
Yeah, the follow-up question would be like, how does epistemics count for that outlier, imperfect, duplicate data? Um,
Yeah, I mean, I think there are a number of obviously statistical approaches that you can use to look at that. But in general, we basically are analyzing a lot of things in terms of like distributions. So we're trying to get an understanding that within a specific population, kind of like what is the distribution or the accurate distribution within that subpopulation. And in the process of doing that, that normally kind of takes out some of the most extreme outliers on both the low and the high end. And that's typically how we're dealing with things. Also, when you're thinking about the way that we simulate the world, we simulate the world in kind of an interesting way in that we kind of do it like the metaverse. We're doing not just one simulation, we're running thousands, tens of thousands, hundreds of thousands, depending on the nature of what we're trying to solve, versions of future, which enables us to get kind of this really interesting look at exactly what is causing certain breakpoints in the world that you're trying to achieve. In a fine grained way, you can understand exactly what behaviors change at what point, and due to what factors. And so in that case, we, are using the outlier worlds are sometimes exactly what we're looking for, which are the ones that have kind of the most interesting behavior that we're trying, want to try to understand, and we normally want to surface to our clients so they can factor into their strategic decisions.
Great, thank you for answering that. One other question that I've gathered was, we've seen Gigasheet's demo. Super cool. Thank you, Jason, for that. If Todd, like if people wanna use hands-on like our simulations, how do they go about it? I know we have the emails here, so if anyone is looking for a demo for your projects, please reach out to the emails on the screen or put your emails in the chat. I'll reach out to you, or Jason is going to reach out on behalf of Gigasheet. But Todd, yeah, if people want to use Epistemix hands-on, like how does that look like?
Yeah, well, would love to obviously be able to show you a demo of it and have a discussion. Generally speaking, we have a suite of products that we can provide kind of off the rack that data scientists can take advantage of, and then we have a range of professional services that can provide customized solutions to your like kind of just key decision makers within your organization. So really depends on the specific use case and types of things you're trying to answer. But get in touch with us. We would love to have a conversation with you and tell you how we can help you drive better decisions through the power of data.
Cool.
Sounds good. Thanks for joining, everybody.